I coach individuals with little to no experience in healthcare information technology, helping them transition from feeling uncertain about their expertise to becoming confident subject matter experts. My goal is to empower you to accelerate your career growth and thrive in your daily professional interactions, equipping you with knowledge and skills needed for success in the healthcare IT field.
Welcome back to the Deep Dive. We're diving deep into healthcare integration projects today.
Sounds exciting.
Well, specifically what to really think about even before you start creating that business requirements document,
The BRD.
Exactly, the BRD.
Yeah, it's like, you're getting ready to launch a rocket, right? I mean, so many different pieces.
Yeah.
Got to make sure they all work together.
For sure. And you need that super detailed plan.
Absolutely.
So our listener wants to know about that pre-BRD phase.
Okay.
And luckily, we've got some great info to dig into.
Yeah.
It's like we've got a backstage pass
I like.
from a seasoned pro.
Yeah, for sure. And one of the first things it really emphasizes is knowing what systems you're dealing with.
Yeah, that seems pretty basic.
But it's not just about like, oh yeah, we've got this system and that system. It's really understanding.
It's like making sure everyone at the party knows how to, actually mingle.
Right,
It's
exactly.
not just show up.
Yeah, so think of it this way. You're integrating an electronic health record system
Okay.
with, say, a laboratory system.
Right.
Okay, knowing what they do,
Yeah.
that's obviously important. But can they actually, talk to each other?
So it's like, can they even speak the same language?
Exactly.
Is that where all those medical codes and data standards come in?
You got it. And the source material specifically mentions HL7, FHIR. These are, the languages that these systems use
Okay.
to share information.
Right.
Imagine trying to follow a recipe in French if you only speak Spanish.
Yeah, it's not going to be pretty.
It's not going to turn out well.
Right.
And so, getting those standards right there in the BRD from day one.
Yeah, so nothing gets lost in translation.
Yeah.
It's just those lab results, right?
Yeah. Super critical.
Talk about critical.
Absolutely. And it's not just about accuracy, though, right? I mean, we're talking about
Because we're talking patient data.
sensitive patient information. Yeah. And the source really stresses that security's got to be top of mind from the very beginning.
Okay, so we're talking HIPAA, compliance,
Yeah.
encryption, all that.
All of that. Yep. Baked in from the start.
Yeah.
Think about it. Sensitive patient data gets compromised.
Oh, that's a nightmare.
Yeah, it's not just the harm to the patient, but
Right.
the legal,
Reputational damage.
the whole 9 yards. Yeah,
It's like building a house, you don't lay the foundation last.
Yeah.
It doesn't work that way.
you're exactly right. And just as important as the tech side of things is really understanding how this new system, right,
Right.
is going to actually work in a real world setting, like a clinic or a hospital.
That's what I always want to know.
Right.
Because it's one thing to design it all nice and neat.
Yeah. And on
But-
paper, it's perfect.
But then reality hits, right?
And that's why considering those workflows is so important.
Workflows, okay?
Yeah, how does patient admission actually happen?
Right.
What about ordering a lab test?
Right.
Or even just a routine discharge?
Okay.
You have to map out how those processes work right now.
Because the best system in the world is useless if it
Yeah.
doesn't actually help
That's right.
people using it.
100%. And, if it messes up their workflow, it just causes delays and errors, and nobody needs that.
Especially not in healthcare.
Especially not in healthcare. And we're
Yeah.
talking about doctors and nurses, administrative staff, the people on the front lines.
Yeah, you want them to love this new system. They'll
Exactly.
be like, ooh, I got to use this thing.
Right, exactly. And that's why another source that we have here really emphasizes getting input from those stakeholders.
Because they're the ones who are going to live in this system.
They're the ones using it every single day. Yeah. And what's fascinating is it's not just about, hey, go talk to people. It's about truly listening
Oh, really? Listening.
and not assuming you know what they need.
Okay, so like what? Give me an example.
Gives a really good example. Something as simple as display a lab order.
Okay, yeah. Seems pretty straightforward.
Right. Seems simple, but what kind of labs?
Okay.
How should it be displayed? Just a list.
Oh.
Or a trend over time. What information do those doctors need?
Wow.
Right.
I didn't even think about all that.
Exactly.
So many details.
It's about finding those hidden things before they become big problems later.
Way better to address it in the BRD than after you've built the whole system.
100%. Yeah.
Wow, this is already eye-opening.
Well-
Who knew there was so much to consider before you even,
Right.
start the BRD?
Yeah, we're just scratching the surface here.
Okay, so we've talked about all those critical systems and those data standards and security and workflows and getting input from actual users. That's a lot to keep in mind.
It's like laying the groundwork for, a massive skyscraper.
Right.
You got to get it right from the start.
You only get one foundation.
Exactly, exactly. And speaking of important things, we got to talk about how well this whole thing's going to actually work, the performance expectations.
Okay, so we're not just making sure the systems can talk to each other,
Right.
but that they can actually keep up with, like, the demands of a busy hospital.
Exactly, exactly. Imagine you've got a system that's constantly, like, lagging or crashing or just can't handle all the data.
Oh, yeah, that would be bad.
That's not just annoying, that could actually impact patient care.
Oh, that's a thought I hadn't really considered, but that's
Yeah.
that's critical stuff. We're talking test results and diagnoses and,
Yeah, absolutely.
treatment plans. Like, delays could be really bad.
Absolutely. And so the source material here, it recommends actually setting those key performance indicators, those KPIs.
IPIs, got it.
Like, think of them as specific, measurable goals for how well the system needs to perform.
Okay, so like how fast data can be sent back and forth between systems.
Yeah, exactly.
Or how much downtime is acceptable that we're talking about.
That's exactly it. Yeah, things like how quickly that data moves, how responsive the system is, how many people can be using it at the same time.
Right.
Those are your KPIs.
Right.
And you got to set, realistic targets for each one.
Okay, so is that where those service level agreements come in?
Yes, exactly. The SLAs, those are like the contracts that really spell out
Right.
what those performance levels should be
Yeah.
and what happens if they're not met.
Got it. So it's like we expect this system to be working 99.9% of the time.
Exactly.
And if it drops below that,
then here's what we do.
then there's a plan.
Exactly, yeah. It's all about setting expectations and making sure everyone's accountable.
Makes sense. And I can see how that would be so important, especially in a place like a hospital, where even a small glitch
Right.
could cause a domino effect.
100%. And don't forget, all these KPIs, these SLAs,
Right.
got to be crystal clear in that BRD.
Of course.
So everyone's on the same page from the get-go.
So it's not enough to just build something that works. It's got to work really well
Well said, yeah.
and be able to handle anything that's thrown at it in a busy healthcare setting.
Exactly. And that takes planning
Right.
and understanding how things work in the real world.
For sure. This has been like eye-opening. I had no idea. There were so many layers
Right.
to this whole healthcare integration thing.
It's more than just plugging in a computer.
Totally. And we're not even done, right?
Yep.
Because we haven't even talked about what happens when things change.
Oh, that's a big one.
Because as we know, healthcare never stands still.
Yeah.
That's for sure. It seems like there's always something new, whether it's technology or regulations or even just, a different way of doing things.
Yeah, and that's why that whole idea of the BRD being a living document is so important.
Okay, so you don't just like finish it, file it away and say, we're good.
Definitely not. No way.
Okay.
You got to be checking in with it, revisiting it all the time.
Throughout the whole process.
Exactly. Yeah. What's changed? Did those stakeholder interviews uncover something you didn't expect?
Sure.
Is there some new security threat that just popped up? You got to stay flexible.
So it's about being flexible, but also like staying curious and informed.
Absolutely. And that's where being able to talk to each other, really collaborate,
Right.
that becomes even more crucial. Yeah. Keep those lines of communication open with your stakeholders. Know what's happening in the industry. What are the best practices?
Right, like don't be afraid to make changes to the BRD if you need to.
Exactly.
It's like they say, right?
Yeah.
The only constant is change,
Ain't that the truth?
especially in healthcare. Wow.
Especially in healthcare. But if you embrace that, build in that flexibility
Yeah.
from the get-go, you're setting yourself up for success.
This has been, we've covered so much ground from those core systems to data standards, security, workflows, getting that user feedback,
Right.
performance expectations, and now this whole idea of adaptability.
It's a lot, but it really shows you can't separate the technology from everything else that's happening, You got to think about the people using it, all the rules and regulations, and how things might change down the road.
It's a lot to think about, but when you get it right,
Oh, absolutely.
it can be amazing, right? It, like truly make healthcare better.
Absolutely. That's what makes it all worth it.
Couldn't agree more. And to our listener, if you're about to dive into the world of healthcare integration, remember everything we've talked about today. Ask those tough questions, be ready to adapt, and don't underestimate the power of working together. You got this.